Good morning, everyone. Thank you so much for coming. I so appreciate your presence today. Welcome to this January's Chat with a Therapist. My name is Mario, and I'm one of the physical therapists here at St. Andrews South. Today's topic is Hope Amidst Depression. I expect to impart on you the understanding that signs of depression are common, and yet they are often ignored and disregarded. There are many things you can do to prevent and help a friend or even yourself in this particular topic. I would just like to make a disclaimer that I am a physical therapist and not a psychologist, psychotherapist, or a psychiatrist. And I do not assume expertise in this field, nor do I suggest self-diagnosing. Rather, that you keep an open eye for these signs and seek help as necessary. So let's begin. Just a quick joke. An American newspaper columnist, Midnight Earl, jokingly quipped, "You think nobody cares if you're alive? Try missing a couple of car payments. They sure will know where to find you." And on a serious note, however, Ogmandino, the author of The Greatest Miracle in the World, as well as The Greatest Salesman in the World, said, "I will love the light, for it shows me the way, yet I will endure the darkness, for it shows me the stars." I quote him especially because he himself contemplated of taking his life years after military service. So what is depression? Is it a sudden feeling of sadness? Is it a fleeting sense of loneliness? Or a short temporary loss of appetite for things that you used to enjoy so much in life? All these could be early warning signs, and the beginnings of possible depression, but certainly not depression. As depression is defined as a mental health disorder characterized by persistently down mood or loss of interest in activities causing significant impairment in daily life. The key word here is persistently. If you're not persistently feeling those things, you certainly are not depressed. However, they are signs already, warning signs, alarm bells to keep note on. The problem is there is a social stigma associated with the word depression. People don't want to be associated with it. People don't want to discuss about it. However, the signs are there. And if they are not addressed, we end up getting it. We get farther and farther down the hole and go into a depression. Like every illness, depression is most vulnerable at its beginnings. If we nip it in the bud, we can certainly stop it. And always remember, you are not and you don't have to be alone to tackle the problem of depression. Our main focus today would be on the late onset depression. It is a form of depression common in older adults. It is often experienced for the first time in persons over 65 years old and should not be considered at all as part of normal aging. So let's go by the numbers, how depression affects the economy as well as how it affects people. So it impacts about 34 million people of all ages in the United States, and about 2 million of them are all over the age of 65. The healthcare cost alone is $71 billion, which is sixth most costly health condition behind only all these common problems of diabetes, heart problems, low back pain, high blood pressure, and injuries associated to falls. And the total economic cost could be staggering at $326 billion. That's the GDP of the Philippines, where I am from. That's over 105 million people to make that money. So that really is a lot of money. It's breaking your bank, breaking the government's bank, breaking everybody's bank. So, however, these are all just money. It pales in comparison to the loss of life associated with depression. So, we all can do something about it. So let's talk about late onset depression. It is simultaneously underdiagnosed and undertreated, and is oftentimes assumed as signs related to dementia. But it is not, and it should be treated promptly. Like Speedy Gonzalez behind in the background, one should run quickly for help, not necessarily to the medical professionals. It could be just to anyone you can trust. Talk it out with a friend, talk it out with family, your loved ones, people you know you can trust. It starts there. If not, it could lead to increased disabilities, decreased quality of life, decreased social interactions, increased healthcare needs, and certainly it could increase for premature death or suicide. But here's the good news. There is hope. When promptly diagnosed and treated, over 80% of older adults can recover and return to their happy, productive lives in their respective community. So you ask, what happened to the 20%? That is where prevention is very important, as even early detection and treatment is not 100% guaranteed. So let's make a short background study on depression and the psychology behind it. In Erik Erikson's 8th and final stage of psychosocial development, you reflect back on life and you are presented with a question: did I live a meaningful life? There arises the psychosocial conflict of integrity and despair. So what's integrity? One looks back at life with a sense of accomplishment. Someone feels successful and fulfilled, where there is lack of regret, feeling of peace, and most importantly, acceptance. Acceptance to the changes in your relationship with your children, acceptance to the things that have happened to the past, acceptance to sometimes even to the point of there's a role reversal amongst families. So acceptance is very important in that level of integrity. However, when someone looks back with despair, the person feels regret, shame, and bitterness, feeling that life was a waste, and often ruminating over past mistakes with sense of hopelessness and depression. So, success in this stage usually leads to feelings of wisdom, while failures result in regret, bitterness, and despair and depression. So, there are 4 major causes of depression. First is biological, genetic, or family history. Research provides evidence of genetic predisposition. People with relatives who struggle with depression are more likely to develop the disorder than those without. There are also physical causes. It can often be triggered by illness later in life, such as loss of vision, Parkinson's disease, arthritis. History of depression in early age oftentimes can be an indication that you can have later in life some form of depression. And there is also an imbalance of certain neurotransmitters. That's why sometimes the doctors prescribe you with medications for depression. Third one is social and environmental sources. There are many stresses in life. including death of a loved one or death of a friend, a very dear friend, social isolation due to disability and loss of long-term friendships, as well as family and financial troubles. The fourth major cause is polypharmacy, drugs, and alcohol. So you've seen all these signs and symptoms probably amongst your peers, and sometimes even it could be from oneself. It can be very debilitating and life-threatening, so seek professional help if symptoms persist more than 2 weeks. So let's go through some of the behavioral symptoms. Let's just go through some of them. Irritability and restlessness, increased challenges in meeting demands of social life and scholastic life, self-harm, and suicide attempts. Cognitive symptoms can be decreased ability to make decisions, decreased ability to concentrate, and slowed thinking and speaking. Physical symptoms can be insomnia or increased sleep, changes in eating patterns, headaches, and digestive problems. Psychosocial symptoms can be feelings of worthlessness, anxiety, feeling of emptiness inside you, low self-esteem, poor self-image, and preoccupation with death. So what do you need to do if you are experiencing a lot of the signs and symptoms? First is psychotherapy. Let's go through this video, as it certainly would help us what we could do about it, okay?
Did you know that more and more Americans are stressed, anxious, and depressed? And studies have shown that these stresses can lead directly to poor health. It can become a vicious cycle, a cycle that's not easy to treat. But now, there's a cure. Ask your doctor about Fixitol, the pill you take once that instantly takes care of all these concerns. Fixitol. Fixitol is not available in North America, South America, Asia, Australia, Africa, Europe, Antarctica, or the North Pole.
While it is true that mental and emotional health can affect your physical health, there's no quick fix for many of the concerns brought on by life stresses. But you can talk to your physician about a treatment that's proven to be effective for depression and stress. When you ask your physician to recommend a licensed psychologist, you're taking a first step toward a healthier mind and body. Through treatment, psychologists arm patients with new understandings and lifelong problem-solving skills. For example, helping you make healthy choices, especially when you're feeling depressed, anxious, or stressed. And though some conditions do require medication, for moderate depression, psychotherapy is just as effective as medication, without the risk of side effects and lower instances of relapse. It is time to talk to your physician, but not about the latest miracle cure. It's time to ask for a recommendation for a licensed psychologist.
So psychotherapy is very important, especially when you're experiencing the signs and symptoms. However, another thing is to see your psychiatrist, and maybe they can prescribe you with medications like Celexa, Lexapro, Prozac, Zoloft. And these medications actually help quite a bit of people. And how do they usually work? This video will show us how they usually work, okay?
The human brain has about 10 billion brain cells. Each brain cell can have as many as 25,000 connections with other cells. Messages, which direct many functions throughout your body, travel through your brain from cell to cell through these connections. For these signals to move from a sending cell to a receiving cell, they must cross a small gap called the synapse. Chemicals called neurotransmitters, located at the ends of the sending cells, help the signal cross this gap. Serotonin is one such neurotransmitter, a very important one that helps regulate mood, emotions, and other body functions. After the serotonin has done its job, it's reabsorbed by the sending cell and is soon back in position to help with the next nerve signal. If you have depression, you may have a serotonin imbalance. Your overall level of serotonin may be low, and some of it may be reabsorbed too soon. As a result, communication between the brain cells is impaired. An SSRI, or selective serotonin reuptake inhibitor, is a medication designed to help increase the amount of serotonin in the synapse by blocking its reabsorption. As serotonin builds up, normal communication between cells can resume, and your symptoms of depression may improve.
Okay. So, we talk about what you can do. One is when you're experiencing a lot of the problems and you're still fine. But when there is severe and very acute episode, we have the 24/7 hotlines. SAMHSA, which is for mental health issues, you call 1-800-662-HELP. National Hope Line Network to prevent suicide is 1-800-SUICIDE. National Suicide Prevention Lifeline in English and in Spanish. And I know it's kind of hard to get through all the numbers. If you really are in that situation, dial 911. We don't usually recommend 911 because they are not trained professionals in handling acute depression and risk of suicide. Only a good 25% of call centers have that kind of service. We're not sure if Palm Beach or any Broward has that kind of training in their dispatchers. But these people are trained. So if you really need some form of help, these are good numbers to know. Like we talked about the 20%. What happened to the 20%? The prevention is the key. Always try to find ways to handle stress and improve self-esteem. Reach out to family and friends when times get hard. And get enough sleep, eat well, and most importantly, exercise. As it is said, exercise is the most potent and underutilized antidepressant, and it's for free. How does exercise then help and affect your brain? Let's listen to this video.
Have you ever thought about what happens in your brain when you're moving around, working up a sweat? Most people know that exercise protects against diseases such as cancer and diabetes. And if you've ever opened a celebrity magazine, you know that exercise helps you with weight control and building stronger muscles. But what happens inside your body is much more interesting. Moving your body will actually help you get out of depression. When you exercise, chemicals that contribute to happiness and pleasure are released in the brain. This means that someone who just finished a power walk feels happier immediately. This part of the brain is called the prefrontal cortex. It has many important responsibilities, and you activate it when you exercise. The prefrontal cortex acts as an emotional brake that helps you handle strong emotions, which can be important when you're going through depression. It's also in charge of concentration. Perhaps you've noticed that it's harder to concentrate. When you exercise, your prefrontal cortex gets busier, and your ability to concentrate and react quickly will improve immediately. So a good idea is to do some light jogging an hour before an exam or important meeting. Now you know a bit about what happens in your brain immediately after working up a sweat. But what happens in the long run if you make exercise a regular thing? Moving your body a few times a week means new brain cells are born inside your head. both in the prefrontal cortex and in this other neat brain area called the hippocampus. These areas of the brain get bigger. The hippocampus is part of your body that you really want to keep as big as possible. Among other things, it's responsible for long-term memory. So, what happens inside your body when you take a sweaty walk is much more important than what happens on the outside. You will become better at handling emotions and be able to concentrate and remember things. Perhaps most importantly, it will affect your mood in a positive way.
So, a study investigated the long-term effects of exercise on people's mental health and depression. They found out that this is a very long-term study with a large number of participants, over 30,000 participants. And this went on for over 30 years. They started with people, regular people, no signs of depression, just normal, regular people living their life. And they followed through them for over 30 years. And what they found, surprisingly, was the amount of depression that was happening in people who didn't exercise relative to people who did some form of exercise. So let's listen to this video.
Clinicians have long known from speaking with their patients that there is a connection between exercise and symptoms of depression. However, much of this research looks at cross-sectional associations, finding that depressed patients exercise less than non-depressed patients. Important work that clarifies the longitudinal nature of these associations appears in this month's journal in a paper by Harvey. This paper is important because it is a longitudinal study that begins with a very large sample, more than 30,000 adults who are free of major depression at the start of the study. And the study follows these adults over many years and asks the question, do individual differences in exercise at baseline predict risk for increases in depressive symptoms? And the main findings to emerge suggest that, in fact, low levels of exercise do predict over time an increased risk for a progression in depressive symptoms. And this should increase interest among clinicians about encouraging their patients to use exercise with higher degrees of frequency, because this suggests potentially that increasing their level of exercise among patients might actually lead to a reduction in depressive symptoms.
So let's finish this with a quote from Fyodor Dostoevsky, world-renowned author of Crime and Punishment. Each and every one of us has a past and a story to tell, and he clearly understands it. And he says, "We are all fond of counting life's troubles, but do not count its joys. If all joys were counted up as we ought to, we would see that every lot has enough happiness provided for it." Okay. Any questions? No? Okay. Thank you so much for coming over. And once again, I really appreciate your time, and I hope you learned something out of this short presentation. Thank you.